So it's really important that we continue to fight for the Build Back Better agenda. I know right now there needs to be a new set of discussions between some of my colleagues and the White House, the rest of the Senate, to make sure that this moves forward. But the healthcare provisions inside the Build Back Better agenda are just absolutely critical. First and foremost, we have agreement in the Senate on most of these provisions, including a provision that would, for the first time ever, allow the federal government to directly negotiate drug prices with the big drug companies. This could result in enormous savings for consumers. The system was rigged back in 2003 when the initial Medicare prescription drug bill was passed. That law actually prohibited the federal government from using its bulk purchasing power to get the best available price for the government and for consumers. But our legislation, which again, agreed upon by all the Democrats in the Senate, if we ever get this in front of the Senate for a vote, would allow for that negotiation. Second, it would cap price increases on all drugs moving forward to say that companies can't gouge you by increasing the cost of a critical drug by 10 or 20 or 30% a year. And it would apply that protection not just to drugs being sold through Medicare, but to drugs being sold in the private sector as well. Additionally, inside the Build Back Better agenda is continuation of subsidies for the Affordable Care Act plans so that more people can afford plans. It used to be prior to the beginning of this year that once you hit 400% of poverty, you all of a sudden couldn't qualify for any subsidies. Well, in the American Rescue Plan, we changed that and temporarily made sure that even folks that are making a little bit over that maximum income still get some help. It made Affordable Care Act plans, Obamacare plans, accessible and affordable to millions of additional Americans. The Build Back Better plan makes that permanent. That means that a whole lot more people all across the country are going to be able to afford insurance. And then one of the healthcare provisions closest to my heart is a provision that would provide money to cities to try to cut down on the epidemic of gun violence, to put money in the hands of programs that surround youth, at-risk youth, with the kind of services that they need so that they can avoid risky behaviors and lives that bring the risk of violence. Gun violence is a public health epidemic, so I absolutely put our efforts to try to curb gun violence in the category of healthcare prevention and healthcare provision. We got to keep the fight on because we're not giving up on the Build Back Better agenda. Yes, it may look different than the bill that President Biden proposed, but we have consensus around these healthcare provisions to lower prescription drug costs, to increase the affordability of ACA plans, and to attack the public health epidemic of gun violence in our cities. And I need your help to keep up the heat.